Thank you for the opportunity to speak as well. About 10 years ago, the National Institutes of Health had the wisdom to sponsor a trial studying transplantation, liver and kidney transplantation in people infected with HIV. And that study clearly has shown that it is a safe and efficacious procedure. The same study, unfortunately, also showed us that folks with HIV can ill afford waiting for an organ. They don't do as well on the waiting list. They get too sick. Our waiting lists are bloated. In San Francisco, right now, if you're waiting for a kidney transplant, you're waiting over 7 years. If you're waiting for a liver transplant, the way livers are allocated, you have to get really sick before you get a transplant. And again, people co-infected with hepatitis and HIV can't wait the time to get a transplant. So there's precedent for using infected donors. We currently utilize hepatitis C positive organs and hepatitis C positive recipients. I told you that our waiting times are 7 years for a kidney transplant in San Francisco in the Bay Area. If you have hepatitis C and are willing to get an organ from somebody with hepatitis C, the waiting time is less than 3 months. We don't have that opportunity in people with HIV because of the federal ban, and it really is, it makes a lot of sense. About maybe 6 or 7 years ago, I got a phone call from the transplant surgeon in Cape Town, South Africa, Elmi Muller, who was going out to procure organs from deceased donors, brain dead deceased donors. And she'd come back and be ready to put them in, and the testing would come back positive, all too frequently for HIV, and she just would throw them away. And she just decided that she was going to transplant them. And she's now done 14 transplants, HIV positive, donors to HIV positive recipients. Her results, in fact, are probably better than our results. And that, in part, is related to the fact that her patients don't go on dialysis, they just get the transplant. So I think all of that taken together, it really is time to move forward from this, the law that was, it was really a well-intended law at the time. But at the time the law was written, I'm sure hepatitis C would have been, we would have been told we couldn't procure organs from patients with hepatitis C. We just didn't know what hepatitis C was in 1980 when I first started doing liver transplants. So I think we're going to hear from the OPTN, but I think every year the OPTN spends countless hours trying to figure out better strategies for improving organ allocation and minimizing death on the waiting lists. And really, this makes complete sense, and we need to at least be given the opportunity to study this. Thank you.